Well, it is the latest diet craze, but can you really lose weight by getting rid of your allergies, or at least attending to them? We're joined by a naturopathic physician, Dr. Andrea Sullivan, who has some great ideas about losing weight, but also about those diets that people are saying, stopping milk, because some people think they're allergic to milk, even if they haven't been tested. And a lot of people are thinking they're allergic to gluten, because that is the hot craze right now.
That is true.
Welcome.
Is very true. It's great to be here.
So are there a lot of people who are actually allergic to gluten and to milk and other things that are making them fat?
There are people that are allergic to gluten and to milk, but it's not necessarily making them fat. One of the problems with gluten is, of course, celiac disease. If you are allergic to gluten, you have problems with your gastrointestinal system, which can be anything from diarrhea, bloody diarrhea, certainly stomach upset, abdominal distress. You could have gluten intolerance, which wouldn't necessarily give you diarrhea, but the heartburn and those kinds of symptoms that people get when they talk about my stomach hurts or I have nausea. The other thing is acid reflux that we find clinically related to gluten all the time. So if people have acid reflux, they may choose to take some of the gluten out of their diet, like the wheats, but also packaged and processed goods, because packaged and processed goods also have a fair amount of gluten, so you always have to read the labels.
Okay, so if someone wants to kind of try to determine without going to see a physician whether they might have a gluten allergy, what would be the things that they should look for?
Well, the main thing is if you're eating a lot of wheat, what is a lot? Okay, you have 2 pieces of toast in the morning, you have a sandwich for lunch, you have bread for dinner. If you have abdominal distress, you need to cut back on some of that bread.
How soon after eating would you have that distress?
Oh, you could have it in 20 minutes, in 10 minutes. You could have it quickly. But you need to cut back on the bread and choose other forms of bread and other forms of flour, or cut out the breads altogether. One of the things about gluten is it's not so much the gluten. There are situations where we're finding that indeed it's the way the bread is processed. It used to be that breads were processed and fermented for 8-10 hours overnight. But now, like every other fast food, bread is made quickly, so the gluten doesn't have a time to convert into digestible proteins.
So you've got some suggestions for us if we are going to test ourselves to see if it's actually the gluten. Cut out the regular bread, and what do we do?
Regular bread, and then you can do things like millet bread, for example. There's Ezekiel bread, which is both of these are in the frozen food section. This is a sprouted bread. It does have some wheat in it, but it's not a flour. So it's a sprouted grain bread. Millet does not have any gluten whatsoever. So that's a great grain to use. Quinoa, these are different forms of quinoa that I have here. Instead of oat, for example, or instead of even brown rice. Not that brown rice is a problem, but some people get tired of brown rice. So they're alternatives.
Well, I like quinoa. I think that's really good. But now, what about potatoes and rice? Are those gluten?
No, potatoes really don't have much gluten in it, but the white potato, for example, doesn't have any nutritional value. The skin has a lot of nutritional value.
But quinoa?
Brown rice is fine. Quinoa has a lot of nutritional value. It's very high in B vitamin. It's very high in protein.
Now, you've got some yummy looking
I have some muffins over here, some zucchini muffins.
Those don't have any gluten either? That's no flour in that?
Well, there's flour in it, but it's different kinds of flour. You can have rice flour, you can have quinoa, you can have millet, so you can mix up your flours. You can get a multi-grain flour, or you can do one or the other. There are all kinds of flours in the health food store these days. You don't have to rely on whole wheat. There used to be a time when we knew white flour was not good for us, then everybody switched to whole wheat flour. Well, now we're recognizing that there are other forms of flour that we can take in and digest much more appropriately.
Let's quickly talk about the milk allergy, too. How do you test out the milk allergy?
Well, many people have lactose intolerance. Other people are allergic to it. And again, you'll have abdominal distress. You'll have some nausea, some bloating, some diarrhea. But milk is for baby cows. Milk is not for us. We're the only animal that drinks milk from another animal as an adult. Even the adult cow doesn't go back to the mother to get milk.
But yet
and I'm not trying to give the milk industry a bad name here, but we need to choose other forms of milk. There's some people that can do milk.
Well, I can't eat a chocolate chip cookie without my milk. So what am I going to have if I have an allergy, which I don't think I have?
You might have hemp milk, and yes, it is the same plant, but it's a different species. You might have almond milk.
Milk, does it taste the same?
It tastes good. It's a little bit thicker than the rice milk. Rice milk is a little sweeter.
Okay, rice milk, and you also
have
milk?
almond milk over here. There's vanilla, for example, and there's unsweetened almond milk. Either one is fine.
So we've got some choices.
You've got some choices.
And so if you're having some problems, acid reflux, stomach aches after eating and drinking.
Especially acid reflux and stomach aches, especially, because most of the world is allergic or lactose intolerant. So we need to get off of the milk, and we need to try some other forms of breads.
Dr. Andrea Sullivan, it's always great to see you. Thanks for
coming.
Here,
Barbara.
And I mean, I guess these taste good.
Now
doesn't matter whether you've got the allergy or not. Might as well try them. Thanks a lot. I want a muffin.